We are the Lab Doctors. I'm Amanda.
I'm Dorothy.
And I'm Zhao Yong.
We are biomedical researchers who realized we still have a lot to learn about science.
So why not join us on this quest?
Hey everyone, welcome back to the Lab Doctors podcast. On this week's episode, we're going to talk about
Monkeypox.
Oh! What's new?
I hate this topic so much.
why?
I don't know, I'm just sick of talking about like pandemics or like
That's true.
Yeah, the next virus. So.
It's good to be informed.
Yeah, that's why. And I'm like, fine, as a virologist in training, I should find out about this, I guess.
The pictures are so disgusting though.
Yeah, they are.
It's like super big lump.
I mean, it's not the people that are disgusting, it's the syndrome.
I say the picture.
The picture lah.
So what is monkeypox?
Great. That is the first question. What is it? So monkeypox is a virus that belongs to the orthopoxvirus genus. So this is the same genus of viruses that cause smallpox and cowpox. Although the symptoms are typically milder and less deadly, do note that it is not the same as chickenpox because chickenpox is from this separate set of viruses known as varicella
zoster.
Yes, virus, which is closer to herpes. So they are not the same genus or even the same family.
Okay.
Yeah. So that's just the
How you classify things.
Yeah, so like Homo sapiens is like genus and species. So the species is sapiens and...
You can Google it.
Yeah.
That's not the point. They are listening so that they don't need to Google.
But I want to talk about monkeypox. I'm so excited to talk about monkeypox. But monkeypox was first discovered in 1958, observed in colonies of monkeys kept for research in a Danish lab. So
What? It came from a lab?
yeah, so it's bizarre. Like it's not entirely sure like what the origins are, or where they come from, or like how it got transmitted to these monkeys in the first place. So it's a bit odd. But the first human case of monkeypox was recorded in 1970s in the Democratic Republic of Congo.
Oh, that's not too far back.
Yeah, but what's strange to me is like, so it originated from a Danish lab, and then the first human...
How far is Congo from?
From Netherlands. Pretty far, I guess. I mean, some might say a different continent.
Some might say. What do you mean some might say?
I don't know what flat earthers say. But okay, but since then, monkeypox is found endemically in several Central and Western African countries, and human monkeypox infections have occurred outside of Africa, but is linked to either international travel or imported animals or imported meats. Yeah.
Monkey meat?
No. As in, the monkeypox is called monkeypox because it was first found in monkeys, but I don't think it's endemic to monkeys.
So what other animals can carry monkeypox?
Rats and monkeys.
Rat meat?
No, so rodents, I think there's more. Yeah, I think I'll mention later. So how it's transmitted though is when a person comes into close contact with the virus through an infected animal, infected person, or contaminated environment or foods. So this is like the pus or whatever secretions. The pus that is from these poxes that might contaminate surfaces of food.
Pus.
Yeah.
P-U-S. I was like P-A-S-T.
Oh, no.
Okay.
So animal to human transmissions may occur by a bite or a scratch from an infected animal. So like even bodily fluids also can transmit the virus. It is also from bush meat preparation of an infected animal, direct contact with the blood, bodily fluids, or skin or mucosal lesions of an infected animal.
Oh,
so
basically don't touch the animal.
Yeah, don't touch sick or unwell animals. So there's like a list of do's and don'ts that I'll go through later.
Can't wait.
Human-to-human transmissions can occur via respiratory droplets or direct physical contact with the blood, bodily fluid, or lesion material from infected individuals or contaminated materials.
So similar to like smallpox and all that.
Exactly. It's all similar to the pox-based viruses. So actually, like, do you think monkeypox is a scary virus? Because until now, I wasn't entirely sure how deadly it was, but people keep talking about it. So I
thought it's not that deadly.
Yeah, it's not.
Yeah, I didn't think it was an issue that we needed to be concerned with.
I just felt like the media recently is like, oh, the next pandemic is coming already. And I'm like, what do you mean the next pandemic is coming? We're still in a pandemic. What are you saying?
I just think it looks ugly lah. Like it looks like you have a serious skin disease.
I mean, you do have a skin disease.
Yeah.
And like, don't come near me because you look freaky. But
no, but also don't come near me because you could pass it.
I honestly am not too sure how easy it is to pass. Like there isn't really a lot of research into it because it's not a very common virus.
Oh.
Yeah.
But because the symptoms are pretty obvious, right? I mean, like you get, what do you call it, growth?
So speaking of symptoms,
What?
so monkeypox is typically a self-limiting illness. So that means that you don't really need external like drugs or whatever therapeutics to help you recover from monkeypox. You can recover from monkeypox naturally by your own immune system. But it presents with fever, headaches, muscle aches, back aches, swollen lymph nodes, chills, general feeling of exhaustion, and the rash often starts from the face and it spreads to other parts of the body as the disease progresses, so towards the palms of your hands and the soles of your feet. Symptoms may appear from 5 to 21 days following infection, so there is like somewhat of an incubation period.
So long, it can be so long.
Yeah, and people with the infection are generally infectious from onset of the fever until skin lesions have scabbed over, which is quite similar to chickenpox.
Yeah, I feel like this is...
But it's not the same type of virus as chickenpox.
So since the symptoms are pretty obvious, right? I mean, like, dude, the palm of your hands and the...
Yeah.
If your feet will get it, then you shouldn't be going out of the house, and therefore it's like it should be harder to spread.
Yeah.
Since it's so obvious.
Yeah.
It's like chickenpox, right? When you know you got chickenpox, you don't go out. Right?
Yeah. So actually, with proper isolation, shouldn't be too big a deal. Yeah, so that's it. Serious complications of death can occur in some individuals, especially those that are immunocompromised. So fatality rates differ from source to source, but according to CDC estimates in 2021, in Africa, monkeypox has been shown to cause death in as many as 1 in 10 persons.
What?
But this is confounded by the lack of smallpox vaccinations and limited access to healthcare facilities, which sucks because I'm like, oh yeah, like this is not something that people with modern medicine have to worry about. So as much as this current spread of monkeypox, so far there hasn't been any recorded fatalities outside of Africa.
Which really sucks.
Which sucks, exactly.
How early do you have to be vaccinated? Or you can be vaccinated at any time?
So you can even be vaccinated like when the infection is confirmed. And this is with the smallpox vaccine.
Yeah.
So I mean, kind of similar to COVID vaccines in the sense that even though it's a different variant, it still confers a level of protection. So your disease won't be as severe. Yeah.
But I thought you don't even need the vaccine also, right?
For monkeypox?
Yeah.
Yeah, you don't.
I mean, most people can self-recover.
Most people can self-recover. So it's only for those who are like really...
More severe?
Yeah. Or like children and elderly. Again, people who are more immunodeficient.
Okay.
Yeah.
1 in 10 is a lot though.
It's a lot, but it's really due to lack of medical access. Yeah. So it really sucks.
Can I ask something stupid and unrelated? Is the smallpox vaccine even mandated anymore?
I don't think so because it's eradicated.
Yeah, smallpox is no longer on the face of this earth, right?
Yeah, but apparently that's how monkeypox like first got introduced in Congo or something. It was during a spout of initiatives to vaccinate against smallpox. So that's why it was really odd, like how monkeypox came about. Yeah, there isn't really too much detail in that.
Also,
report.
I must say like records and everything, as in like data and information last time is not very well organized.
Yeah.
And like all these things, because you have to label everything, right? You know, like how our vaccines, everything is labeled and everything. I don't trust like humans, but like computers now like really make that process like so much easier to keep track of like everything so that you don't get
the wrong vaccine
or like the wrong thing, you know? Yeah.
Okay. So why the current concerns? Like why is WHO concerned about this current spread of monkeypox? So from what I gather, this is my interpretation of their statement, their release. So the first concern is that it is appearing in countries where monkeypox is not endemic and is fairly widespread given its mode of transmission. So like I said, like you have to touch contaminated materials, you have to get into contact with an infected person.
Yeah.
And yet it is in quite a number of countries. So in alphabetical order, as of 25th May, they have been isolated from Argentina, Australia, Austria, Belgium, Canada, Czech Republic, Denmark, Finland, France, Germany, Italy, Israel, Netherlands, Portugal, Slovenia, Spain, Sweden, Switzerland, the United Arab Emirates, the United Kingdom, and the United States of America.
Oh, Singapore's not on the list, but Singapore had its first monkeypox case.
Yeah. The more pressing concern is that reported cases thus far have no established travel links to an endemic area.
Huh?
Exactly.
So where's it coming from?
That's the question. Like, in fact, genomic sequencing from, but this is like a single confirmed case. in Portugal indicated a close match to the monkeypox virus to previously exported cases from Nigeria to the United Kingdom, Israel and Singapore back in 2018 and 2019. So Singapore actually had a confirmed case of monkeypox in 2019, and that was a 38-year-old Nigerian man who arrived in Singapore for a workshop, and it was later confirmed that he contracted the virus from contaminated bushmeat. There were no other cases from that one case, and it was good to note that so Singapore had a press release, and then there was contact tracing and surveillance and everything was already in place since 2019.
Wow.
So quite impressive, I guess.
Maybe it's the bushmeats then.
Yeah, but then that's the strange thing. Why is the genomic sequence closer to these exported cases from the past? How did it disappear for 3-4 years and then now it's just magically come back?
Time travel.
Oh.
The multiverse.
Yeah, I don't know. So unless it's people have been infected constantly, but no one knows
really. And then it's been spreading, and then suddenly now one person has severe symptoms.
And then they tested that it was monkeypox or something.
I doubt it though.
Yeah, it's very strange.
It's so obvious. Like Dorothy said, the symptoms are so obvious.
Does everyone get that obvious symptoms?
Yeah, and so unless people have been misdiagnosing, they're oh, maybe it's another type of pox.
What?
Because it's self-limiting, right? Unless your disease is very severe, why would you?
You would just stay at home.
Yeah.
And be oh, I have weird lumps.
With a lump that big on my hand.
But wasn't chickenpox the same though?
I mean, I never got chickenpox before, but
I thought
it's smaller.
It's smaller.
Chickenpox is smaller.
But I guess it's not something that you will actively try and think against. I don't know.
Yeah, I mean, weird. If I didn't know, I would just be oh, probably chickenpox. If I haven't get chickenpox before.
Yeah, so I feel
I feel some people are oh, maybe I just got chickenpox again, not knowing,
Yeah.
I wouldn't want to look at myself. Because it's so big. Those lumps are so
just
scary.
Shatter all the mirrors. Shatter all the cameras.
But eventually it will go away, what?
Yeah, it would.
I think it's more okay, I just have to live with this for a few days and not see anyone. Then maybe not tell anyone about it. That's how it keeps spreading.
Maybe.
Is it itchy, those things?
Sorry?
Are these lumps itchy?
Yes, they are. So that's why you can scratch it open and that's why there can be pus and whatever.
But you shouldn't scratch it.
That's why you shouldn't scratch it also.
Oh, so are we at the do's and don'ts?
So we are at epidemiology, even though there really isn't much. Because I was curious how come it can come back?
Yeah.
And so the natural reservoir of monkeypox remains unknown.
Oh, it's bats. Spoiler. It's always the bats.
I don't know.
Poor bats.
No lah.
But it's actually quite cool.
False news.
False allegations. How dare you?
Allegations, yes.
Alleged bats are the reservoir.
Poor bats.
Anyway, however, African rodents and non-human primates like monkeys may harbor the virus and infect people. So these are not reservoirs though. So it's not the virus incubate in these animals. These animals also get the disease.
Yeah.
So that's what it means by the natural reservoir is still unknown, because unlike most respiratory viruses where bats are involved, bats don't experience symptoms.
Yeah.
And that's why it can keep passing on.
Wait, but then that means you see lumpy monkeys.
Yeah.
Are you really looking at the monkey's extremities for lumps?
No, maybe and lumpy.
I would totally
lumpy
miss
rats.
it.
Yeah, I don't know if the rats become lump, but I guess so. Yeah.
Oh, poor rats.
Yeah.
They don't have much surface area of skin to play
be lumpy.
with.
Maybe the lumps are small.
I think the lumps are smaller though.
Yeah.
I hope so.
Proportional.
It's not the lump will cover the hand. This is 4 lumpy legs. Why are we laughing at the poor rat?
So it's our coping mechanism because we feel uncomfortable with the pain.
Okay, but yeah, so things you can do to avoid getting monkeypox. So first things first, I feel it's the same as COVID or with any other viruses is
wash your hands.
With soap and water regularly, or use an alcohol-based hand sanitizer. The second one is only to eat meat that has been cooked thoroughly. The third one is to contact or seek healthcare professionals if you develop symptoms.
Wait, can I ask meat as in what about fish? Can you eat raw fish?
Oh, yeah. I guess that's
it's not really spread in the fish.
No, but that's the thing lah. If the person who prepared the raw fish is infected, then there's a chance of infection from there. Yeah. So
also it's like where the food processed, and
coming from. Yeah. So it really depends. But like in general, I guess if this really becomes, oh my God, please, no more pandemics. But like, fingers crossed, if there is going to be a pandemic, eat cooked meats, like properly prepared cooked meats. The third one is to contact or seek healthcare professionals if you have symptoms, especially if you return from countries with cases. Yeah, then you should also inform your doctors of your travel history, because it's important to start like isolating and like ensuring the spread of the virus is like, controlled. Yeah. So do not go near wild or stray animals, including animals that appear unwell or are dead. So please don't use your phones and take TikToks or whatever young people do nowadays of dead and unwell animals. Do not eat or touch meat that are improperly prepared from wild animals. So that's what it means by bush meat. So like meat from wild animals. And also do not share bedding or towels with people who are unwell and may have monkeypox, which I feel should be self-explanatory, but people are strange. So we need to say these things.
Yeah.
But do you need to wear a mask?
I guess not. The transmission is not as
easy.
With respiratory route.
Yeah.
I guess it's like what I mean. I would just treat it as how I would treat someone with chickenpox.
Yeah, I would say that's the go-to.
And I don't think it's necessary to like go around vaccinating people with smallpox vaccine.
Yeah. They were saying
like I know people would. I think that's one of the things that people would be like, oh, so we should get the smallpox vaccine also.
I thought people hated vaccines. What's happening?
There's two extremes.
Yeah. There are two extremes. People who are like, give me all the vaccines. But
didn't we have that vaccine when we were younger?
No, because smallpox was not like...
No, but I thought smallpox was eradicated from the earth.
But anyway, I guess, but I still guess it doesn't hurt to wear a mask. Like, it never hurts to wear a mask.
Yeah.
I don't understand why people hate wearing masks. I love wearing masks. I love like anonymity. I love that people can't recognize me, even though people still recognize me. I thought I have a very unrecognizable face. Anyway.
Yeah, you are like Chinese boy.
Typical Chinese boy face. So I don't understand how people still recognize me.
Yeah, because I feel the same. I'm like some Chinese girl.
Yeah, I don't know.
Anyway, on the first search, according to the National Institute of Allergy and Infectious Diseases, currently there's no evidence of naturally occurring smallpox anywhere in the world, except small quantities of smallpox virus officially still exist in 2 research laboratories in Atlanta, Georgia, and in Russia. I always be like, why do they need to keep this little vaccine? Okay, but because they don't know if it will ever research, but I always feel that it might research from the lab itself.
No, but like it's also to be able to generate new vaccines and stuff like that.
Yeah, like cross.
Yeah.
It's quite cool actually. I think that was like the cool takeaway for me. You can like vaccinate with smallpox vaccine.
Yeah, which is why it's important to know like which family of viruses this, or rather genus.
And how similar is, I guess that's why you should also keep it so that you can always like sequence it with like newer technologies and stuff. Yeah, because like who knows, in the future maybe there's like some other technology that doesn't exist now. So you would still need the samples, right? Yeah.
Great. And as usual, follow us on Spotify and subscribe to our YouTube channel. A like and a comment would really help us out.
You can also follow us on our social media, Instagram, Twitter or Facebook, and feel free to DM us any questions.
Alternatively, you can email us at thelabdoctors@gmail.com. Do check out the episode description where we'll link all the articles that Joy talked about during this episode. Thank you.
Bye.
Bye.